You're tuned to Evergreen Media Network. I am Cindy Schwartz, and this is the Patient Partner Show. We're a podcast, and we are also broadcast on iHeart, so look us up on that. In this episode, we have a sponsor that we'd like to highlight. It is an environmentally flushable bag for dog feces. It's a new product that's trying to get out there. It is called Ploop Bags, P-L-O-O-P, bags.com. So look it up on that. If you are one of the people, hopefully not in the data, I did a little bit of research on that, the 40% of people do not pick up the dog poop when they're walking their dog. And a lot of that stuff, especially here in South Florida, there's so many stories about this thing with the pollution and the runoff into estuaries, the rivers, the Everglades, all kinds of things. So think about that. It might be an easier way for you to dispose of the dog poop because you just pick it up and it's fully flushable, throw it in the toilet. It's got a paper layer that's a little bit more comfortable to pick up all that squishy stuff. I don't want to get disgusting, but look it up if you're interested. Ploopbags.com. Jeannie, we are talking about the fake ICU is the headline about a dental student, sadly, who died, and there's a case going on about it because the care that he received in that ICU is not what you would want in any ICU or probably any hospital room whatsoever, but specifically ICU is supposed to gear towards all this stuff that's quick, best care. So let's talk about that because I was talking to an RN a week or so ago about one of the big box hospitals that she worked in, one of the facilities, and she said that's the way it was in that facility. Of course, we can't mention any names, but she said she got out of the care in the ICU as an ICU nurse because of what she saw, how bad the care was. So that is very disturbing, Jeannie.
Yeah. Well, this young man had walked into the emergency room and complained of abdominal pain and vomiting. And within hours, his condition worsened, and he was diagnosed with a series of really, serious things and alcohol withdrawal. So by late that night, he kept deteriorating, and they transferred him to the hospital ICU. And what the attorney is allegedly saying is that this hospital uses tele-ICU, which means there's no doctor on site, that
Right.
It's done via the phone or computer or however during the overnight hours. So this young man was not assessed for hours, so the lawsuit claims. The doctor who was assigned to him never physically saw him, it is alleged, even after being notified that he was declining. But instead, his care was handled partly through the tele-ICU system. So what the family is saying is that they would not have allowed their son, to be treated through a tele-ICU or a fake ICU, because we've always been told that's where you get the highest level of care. At least that's how I've always been told.
Mm-hmm.
And if you have a tube, you need special care, which I guess this young man did. And the lawsuit alleges basic medical protocols were ignored and required assessments for alcohol withdrawal, they said, were not performed. Fluid monitoring, they said, was not done, and no physician evaluated him despite his declining condition. His parents, they said that they were never notified as his health deteriorated. So later that night, early that morning, the young man slid down his bed and became unresponsive, showed seizure-like activity, and began vomiting. His heart rate dropped. The code was called, but they could not save him. He died at 6:09 a.m.
Mm-hmm.
Now, there's a whole slew of things here, and we talk about this a lot, Cindy.
We do,
lack of communication,
right. Yep.
Missing or delayed nursing documentation.
Yep.
We've talked about this. It's happened to my husband, where it's done hours, even days afterwards. They cannot get it right, I don't think, if they don't do it at the moment. and confusion during emergency response, which my husband also suffered. In one instance, they allege a provider called to perform a critical procedure but could not immediately locate the ICU, contributing to even more delays in care.
Yeah.
It also claims inaccurate entries into the medical records, which, again, Cindy, we've talked about this a lot. The lawsuit says that this young man's death was preventable. It is just a shame because an ICU unit, in my opinion, needs a doctor, at least one on staff, because you're not in there because you're doing well. You're in there because things are drastically wrong or unstable.
Yeah, that should be 24/7, 365.
Yeah.
I mean, to me, there's no question about that. Why is it even on the table that something like that can have less care? It's just ridiculous. That ridiculous isn't even in the right word. I mean, how can that even be up for discussion at all, except if you don't care about the patient?
Right. And I mean, nurses, they can only do so much.
Well, legally as well.
Yeah.
Legally as well.
Yeah. Right. So, I mean, I feel so bad because a lot of people wouldn't know this because because you're not there at night. A lot of ICUs do not allow people to stay overnight in the room with patients.
Some do, but yeah, I mean, I don't know every room. You don't know every room, right? And it just depends. But it's critical care. I mean, that's the height of any care that you're going to get, supposedly. And these stories come into light. Like I said, I talk with a nurse here in South Florida, and, again, we can't mention any hospitals, but it is a big box hospital idea where she said that's why I got out of it. That's what my focus was all along. And then when I saw this go down the hill, I couldn't do it anymore. Ethically or my conscience, I couldn't live with myself. Why not giving the best care to these people when they absolutely needed it at that critical time? So.
Yeah. I mean, and on the flip side, ICU care costs a lot of money.
Yeah, it does.
And if you're not getting it, then that to me, in my opinion, is fraud. It's misrepresentation.
Totally.
It's fraud. It's
It's
besides endangering people.
And this is all our opinions. I mean, certainly it is. We're not doctors. We're not lawyers. But I mean, we do, you and I, Jeannie, we research a lot. I talk to a lot of people in the healthcare industry on purpose. And I ask questions. Most of the people won't come on because they don't want to jeopardize their jobs. They don't want to be the whistleblower and all of that. But I mean, I am saying the information secondhand. I do try to get the people on. And a lot of times, like I said, they won't come on because they can't jeopardize their livelihood. I get that. But that's where I get the information that they're moving around in the hospital and, doing different things. And the care isn't what it used to be. One nurse told me that a lot of people are in that industry now because of the money and the benefits. It's not really about patient care being foremost center above and beyond. Above and beyond. So sad. Yeah.
And the sad thing is about these lawsuits is, in my opinion, is that they get settled and the public never really knows what the decisions were.
Right.
They just know that there's a settlement. And, will this stop? That's my worry. Will these ICUs, will that stop? Will they realize that they need to have a physical doctor on staff right there in that unit? That's the things that bug me, because the lawsuits are to bring silence. So you never really are sure, what happened.
Right. Well,
what got settled.
Right. Well, that's why I'm not a lawyer, but we only got a couple of seconds left. That's why it gets settled. You don't want all that stuff to go out into the public. Right. I mean, in my opinion, and I think partially that's true. Yeah. I mean, that's why it gets settled. The public's never going to see the light of day of any of that stuff. And we talk about that all the time, Jeannie. It's just, what do we do? And on that note, stay listening to Evergreen Media Network.